Hello there, and you're very welcome to Shoiga and O'Shea.
Yes, indeed. Thanks for joining us. Now, 1/5 of Irish women and 1 in 10 Irish men say they'd consider having plastic surgery. But would they think again if they knew the number of botched operations are on the increase? Later, we'll be examining plastic surgery horrors and indeed...
And this is take away the confusion that most Irish people have regarding this. One of the problems in Britain and Ireland, unfortunately, is the fact that just because you have qualifications in plastic surgery doesn't necessarily mean that you have any cosmetic sort of qualifications.
Okay.
There isn't established Royal College cosmetic surgery procedures or examinations. So a lot of people, after they get their plastic surgery qualifications, do add on courses. And one of the things that we've asked the government to do, not only in Britain, but in Ireland, but also in Britain, to have it like other countries to an extent, that you have SHOs, registrars, senior regis, people doing 3 years courses just specialising in this to bring it from the outside into the sort of the normal sort of paths of medicine and have examinations in it. And this is the reason why a lot of general surgeons can come into this country who may have done 500 facelifts, and a plastic surgeon in a public hospital may not have done one. Where would they get the chance to do it if they work in a public hospital?
Sure.
Because facelifts just aren't done there.
Okay.
So it's time we all, I think, grew up and matured about this and made it an established branch of medicine.
Marie, would you agree with all of that?
Absolutely, absolutely. Rejuvenate, actually, which is, I'm managing editor of Rejuvenate, which is Ireland's first and only cosmetic surgery magazine, but it actually emanated from another health magazine that I had, and we were constantly getting emails and phone calls from women and men in relation to where they should go for surgery, or would we recommend anybody. Obviously we weren't, and that's how the whole idea emanated. So I have to say at GRAS...
So what's your role in Rejuvenate?
In my role in Rejuvenate, okay.
No, what's the role of Rejuvenate? What service do you provide?
Okay, our main thing with Rejuvenate was to educate. I mean, we cover, insofar as we get some of the best surgeons who write about different procedures every issue, but we took a very, very mature approach. There's like 16 pages in the last issue on questions that you should ask yourself. I mean, we will be calling for regulation in the next issue and going into detail about it. And a lot of people might think on a consumer magazine that may read very boringly. It was very important to us from the beginning. So like 3 months ago, we actually laid out a set of rules that if somebody was going in, these are the questions to ask, these are the websites that you go to, these, if you sit down with your practitioner, make sure it is the person that in the consultation that is performing the procedure, how many times they've done this operation in 1 month, not an entire whatever. So there's about 20 questions, and we will be repeating that next issue, and also setting up a poll, an online poll, so that readers will be able to communicate with each other.
Do you think that the risks are underplayed and that some people don't treat it as seriously as they should?
Absolutely not. I think what has happened is you can go, when you're doing research, the whole backbone of Rejuvenate is information is power. I think we've done a very good job in that, and I know for a fact that there are women and men who have gone for, and I might point this out, this is really important, both invasive and non-invasive, both are, every form of surgery has a risk.
Sure.
And everybody should look at the reasons. We even actually, every issue, have a psychologist who comes in and writes articles in relation to the reasons why you should ask yourself why you're having any form, whether it could be self-esteem issue, it could be breakup of a relationship. So it's education. That's what we do.